Dr. Kutzler, I am so glad to have you here. I couldn't wait to speak to you because there are so many questions that I have and our dog lovers around the world have about not only sterilization and reproduction of dogs and how to prevent overpopulation and keep them still safe and healthy, but also about the problems that may be related to sterilization and hormone deficiency. So tell us, how did your journey start early on? And you can start as early
Sure.
or as late as you wish.
Thank you very much. It's very nice to meet you and have this opportunity to talk about this with your audience. I started on this journey probably like most veterinarians do. In veterinary school, we were pretty much taught that if it was a dog or a cat, they needed to be sterilized, surgically sterilized as early as possible. What that really meant was removing their gonads, because as many veterinarians know, most, if not all of the uterus isn't removed when the female is sterilized. So really, we're just talking about removing the gonads. Since this is what I was taught in veterinary school, I didn't question it. Again, like most veterinarians, this is what we're taught. So we assume that's right. And then we just plunged ahead. Now, I graduated from veterinary school in 1993. And at that time, the recommendations by veterinarians were still to wait until a dog had gone through puberty or was, in that 6 to 12 month age. And some of that recommendation, I think, stemmed from the quality of anesthetic protocols that we had available. Of course, nowadays, the anesthetic protocols and anesthetic monitoring techniques that we have are so advanced that, we can do general anesthetic procedures on, very, very tiny pediatric, neonatal even patients. But the reality is that the age of sterilization started to incrementally decrease to the point where it was considered quite common to sterilize pet dogs and cats, as early as 3 months of age, because the sooner the better. The shelter industry, anywhere weaning or older was considered the norm. So 5-week-old dogs and cats, sterilize them as quickly as possible so that there'd be no concerns about them, procreating. Of course, again, when I graduated from veterinary school, the recommendation was to wait. And even at that time, shelters would send certificates, right?
Absolutely. I remember
that. When your dog was between 6 and 12 months of age, you would go to your veterinarian of choice and have the procedure done, for free. But essentially what's happened, at least in my opinion, shelter and welfare agencies have said, you as owners are an irresponsible lot, and we can't trust you to keep your pets from procreating. So we are going to then take that out of your hands, and we're just going to sterilize your pets as early as possible. And when we all believed that there was no harm in sterilizing them, then it made sense, I guess. Let's sterilize them as early as possible. Why not? If there's no harm, then why not? But with time, harm became evident. And what really clued me on this actually came in two parts. My husband's parents, so my in-laws, had Rottweilers. They didn't breed them. They just appreciated them as a breed of dog. And at one point, when I first met my husband, they had five adult Rottweilers living in their house. So it was a lot, a lot of dogs. And over the course of a few years, incrementally, one died from cancer, and then another died from cancer, and then another died from cancer, and then another died from cancer. And pretty soon, all 5 of these Rottweilers had died over, what seemed like just a few years period of time. And I was really concerned. I thought, gosh, they live on a farm. Is the water, polluted? If the dogs are dying, is this something that we should worry about for, human health? And right in this kind of same time frame, Dr. David Waters gave a plenary lecture at the Society for Theriogenology, and I was asked to moderate. His topic, was this, kind of the effects of ovaries on longevity in Rottweilers, and it didn't really dawn on me that this would be a topic that I would be interested in, because again, I had been taught all my life that you didn't need ovaries for anything if you weren't planning on breeding them. And I sat there as the moderator. You have to listen intently, just in case someone asks questions. You have to ask questions. And as he went on, I developed a pit in my stomach, and my heart started to sink. And as he was explaining what he was observing in Rottweilers, I was seeing in my family's dogs, and at that time, he hadn't the explanation of how the gonads were increasing longevity or sparing these dogs from developing cancer until later in life. That link hadn't really been established yet. All we knew was that the gonads were good, right? That there was harm if the gonads were removed. Subsequent to his research, others started to provide their data as well. Dr. Ben Hart is probably another good example of somebody who has really investigated the long-term health risks of removing the gonads, looking at musculoskeletal conditions and cancer as well. And so, again, with all of this kind of going on in the background, as a reproductive physiologist, and really just as a physiologist in general, I became really interested in what the link was. We had already known that after dogs are spayed, there is an increased risk for them to develop urinary incontinence. Sometimes this is just referred to as spay incontinence or estrogen responsive incontinence. But we already know as well that it's not estrogen exactly, but it is the overproduction of luteinizing hormone, or LH. When you give estrogen, you cause a negative feedback and the reduction of LH, but we can also return to continence those incontinent dogs if we just lower LH by other levels. So if we give a gonadotropin releasing hormone implant like suprelorin, or if we used a GnRH vaccine, which also lowers LH levels, the dog's continence is restored for that period of time. That research initially with suprelorin was done by Iris Reichler in Switzerland, and her group had also looked at another, albeit maybe not as significant as urinary incontinence, but another problem that we see in spay dogs, which is commonly referred to as puppy coat syndrome. Some people refer to it as alopecia X, but the skin and the whole hair follicle skin complex, what is referred to as the adnexa, have lots of receptors for LH. And what Dr. Reichler's group showed was that when the ovaries were removed and LH levels were high, what happened was the hair did not fall out at the appropriate time. So the hairs remained, there longer. So they didn't shed properly. That gave them this fuzzy hair coat. It's kind of fun to think your dog has a puppy hair coat, but not really when it doesn't shed and it mats and is unhealthy. They have skin problems. And then Dr. Reichler's group gave them, again, a suprelorin implant, a delzorilin implant to lower LH levels, and their hair shed out beautifully. And then as soon as the implant wore off, they developed puppy coat syndrome. So really proved Koch's postulate here that this is an LH problem, not an estrogen problem per se.
So it sounds like you started getting first the clues at home with your partner's family and their dogs. And, I appreciate your situation because you really, obviously, you love the dogs and you knew them, and suddenly you as a veterinarian are not really having the answers to what's going on. So I can understand. I also really appreciate your integrity, that once you realized that whatever you were doing or whatever we as a profession are doing was not right, and that there was something going on, that you immediately started to search and didn't settle for the status quo.
Right.
And I'm sure that dog lovers around the world will appreciate it, because you are, in fact, the pioneer of this, or one of the pioneers of kind of giving us more information. And so just to backtrack a little bit, can you give our listeners and viewers your professional degrees and certifications that you hold?
Of course. I have a Bachelor of Science in Veterinary Science and a Doctor of Veterinary Medicine, both from Washington State University. I hold a PhD in physiology from Cornell University. I'm a board certified theriogenologist, which is a veterinary reproduction specialist. And I most recently earned a MBA in organizational leadership from Oregon State University, where I currently am employed.
So you're a little bit of a Da Vinci of veterinary medicine. You like many interests and so on. I can relate. They say that one of the joys of life, or one of the aspects of life that makes people happy, is actually learning. And I can see that you definitely love to learn. Speaking of hormones, can you give our dog lovers a simplified idea how the hormones work, from the hypothalamus to pituitary gland and the sex glands or hormones?
Yeah, absolutely. And I know that I rattle off these hormones like I've been, saying them all the time, which of course I have, but the master hormone that regulates all of reproduction is produced by the hypothalamus, which is kind of the more primitive area of the brain. Even, very low invertebrates have a hypothalamic-like organ. And the hypothalamus secretes lots of hormones, but the one that is involved with reproduction is called gonadotropin releasing hormone. This hormone, which is just abbreviated as GnRH because it's such a long word, travels through enclosed circulatory pathway in the brain. It's called the portal circulation between the hypothalamus and the pituitary gland. And so GnRH binds to receptors in the pituitary gland and causes the pituitary gland to release either luteinizing hormone or follicle stimulating hormone. Those are the gonadotropins that the GnRH releases. The pituitary gland is part of the brain, but it's kind of slightly outside of the main part of the brain, if you will. It's actually located just above the roof of your mouth. Not that has anything to do with what we're talking about. And it produces lots of things. It produces hormones that regulate cortisol release, thyroid hormone release. It's regulated in melanin production, so skin tone, many hormones. But of course, we're talking about gonadotropin releasing hormone and the hormones it releases, and luteinizing hormone is one of those. So luteinizing hormone, after it is released from the pituitary, it goes into your general circulation, and it binds to receptors. That's kind of the way hormones work. If you think of a hormone like a key and a receptor like a lock, when the hormone binds to its receptor, it's like the key unlocking the door, and then you open the door and kind of see what's going on. Well, that triggers the cell to do whatever that cell was intended to do. In the reproductive tract, when LH binds to its receptors, it causes estrogen production or testosterone production. And it also causes some other things in the reproductive tract that support reproduction as a whole. I think for the longest time, people thought that receptors for luteinizing hormone were restricted to the reproductive tract because physiologists have understood this feedback cycle that exists and have known for more than 7 decades that if you remove the gonads, LH levels rise significantly and remain significantly elevated for the rest of that animal's life. Kind of the belief was that if there weren't any doors to open, it doesn't really matter how many locks you have, right? But now we know that there are LH receptors all over the body.
There are many doors. There are many doors.
Many doors, yes, many doors that are opened. And I talked about those ones that are on the bladder that result in incontinence in some female dogs. I talked about the ones that are in the skin which can result in
Itching.
allergic dermatitis, abnormal shedding patterns, a whole number of skin-related issues, alopecia.
Yes.
But there are also LH receptors present in the thyroid gland, in the pancreas.
How about bones?
Bones, yes, on a subchondral bone, on ligaments, on white blood cells, specifically lymphocytes. These are the white blood cells that produce antibodies and are the ones that actually, respond to antigens, bacterial, viral antigens that an animal, that we might be exposed to.
Mm-hmm.
And it's the LH receptors present on lymphocytes that got me really intrigued. And that's kind of one of the more interesting parts of my current research is how high levels of LH trigger the development of a cancer called lymphoma, which is essentially the cancer of lymphoid tissue, or more specifically, lymphocytes.
When you look at this, we basically sterilize the conventional way. We basically take away the doors that are the most significant for the hormone to affect. And suddenly the hormone is trying to find another
door to open, right?
Door. This can cause all sorts of different issues and reactions all over the body. And we have been trying to solve, let's say, the skin issues or the cancer issue or the mobility issue, the ligament issues, the joint issues for many, many decades. And suddenly it feels like an aha moment that would explain at least partially why all these issues are happening. So how do you actually recognize, I'm really curious, how you recognize the receptors? Do you somehow mark them with a radioactive substance or some sort of, how do you recognize the receptors?
There are techniques that use radioactive isotopes, but more environmentally safe methods are available. They call non-isotopic methods to identify them. And so we use a technique that's called immunohistochemistry. And what this technique does is it takes antibodies that are prepared actually from rabbits, laboratory rabbits, that are immunized, if you will, against the protein of interest. In this case, it would be a canine LH receptor. And then just like any immunization, the animal makes antibody response to that. A blood sample is collected from those rabbits, and then the serum is purified and sold as an antibody that can be used for research purposes. And we use that antibody preparation in this technique where we have very thin sections of tissue that have been taken from, ligaments or thyroid gland or
any tissue,
and incubate that tissue with the antibody, and then rinse the antibody off, and then add what they call a secondary antibody, which that antibody recognizes the first antibody. It's actually an anti-rabbit antibody. After you rinse that off really well, you incubate that with a marker that recognizes a special protein that has been added to the secondary antibody. And then after you do all these things, when you look at the tissue sections under the microscope, the cells that have LH receptors are shown as red, or I say red, but it's really more like rose.
Okay, pinkish.
Not like a bright red. In order to identify the rest of the cells in the tissue, we use a counter stain. Our lab uses hematoxylin. It's a blue stain. So you have everything staining light blue, and then anything that's staining red or pink. Those would be the cells that have LH receptors.
How did you feel when you discovered that all these receptors are all over the body, and that us castrating and spaying animals may be causing serious problems? How did you feel? And when was it? How long ago was it?
Right. So, I wish that I could say that I was, the first to discover that these receptors were outside of the body. But the reality is that most of the initial work has been done in humans and in laboratory animals. And we were the first to show that LH receptors were present in lymphocytes in dogs. But that had previously been shown in humans and in rats. So the fact that we confirmed that it was also true in dogs wasn't such a big jump. I mean, it just hadn't been shown before. We were the first to show that there were LH receptors in the thyroid tissue of dogs, but that had been previously shown in humans because women, after they go through menopause, also have very high levels of LH and are very more likely to develop hypothyroidism. And so this link to high levels of LH and hypothyroidism had already been shown in women. Our hypothesis was that we would see this, and of course we did.
Yes.
So we were the first to show that there were LH receptors in ligament tissue, but that has subsequently been shown now in other species to confirm our research. And so how does it make me feel? I mean, I don't think I'm particularly happy about it. I would, be certainly happier if there weren't LH receptors in all these other tissues, because, there are billions of dogs and cats worldwide that have been, that suffer from high levels of LH. And I can't treat all of them. I can't help all of them. All I can really do is explain that removing the gonads causes harm. All right. It's not this harmless surgery that we all thought it was previously. And owners, if they are making the decision to, electively have this surgery done, need to be explained what these potential
side effects are.
Yeah, right. Because, what I see, I do relief work at a local VCA practice. I like to keep my toe in the game, if you will. Leave the university for a while and see how it is to be a regular veterinarian. And I've seen that case where the puppy was sterilized early. Let's say they got it from a humane society, and it's happy. And then over the course of the next, 6 months, it starts to develop some anxiety issues. And, before it's a year old, we've already got it on fluoxetine, Prozac, an anxiety.
Yeah. So even behavior, maybe, are the receptors also found in the brain?
Oh, there are. Yes. So in the hippocampus and the amygdala. So, two areas of the brain that are really involved with that fight or flight response.
Yes.
There are lots of LH receptors there.
Wow. Wow. It's like, I'm really holding myself back so I don't interrupt you, but it just kind of like really rings the bell for me, because I've had 2 dogs in my life, adult life. And as a child, I used to be around horses and so on. So the first border collie that I adopted in 2001 was on good diet and all that. But, around the age of 1 year, and he was neutered around 8 months, I started developing inflammatory responses in his muscles and back pain and this and that. And even though he lived until he was 16, I felt that he never was as good as he should be and could be. And so for me, it was a puzzle, physical therapist and chiropractic and underwater treadmill and rehabilitation and all that, especially as he aged. And so I was determined to do differently with my second dog, Pax. And so Pax, just to give you a little bit of background, I'm a sleepwalker. And I sleepwalked through glass door.
Oh, my goodness.
And I almost died by cutting one of my major arteries in my leg and lost 3 liters of blood, which is like 3/4 of a gallon or something like that. And so I actually have border collies to actually prevent me from walking through glass again. And so this dog grew up amazingly well, 18 months, strong, robust, good skin, good, healthy, like amazing. Like I was just so happy. And then it came to the point where the training agency told me, if you want to certify your dog, you have to neuter your dog. Plus, he was also cryptorchid. I had 2 challenges. I knew that I didn't want to neuter him, but in order for him to get certified, I had to neuter him. And in order for me to be able to travel with him humanely, again, I needed to neuter him. And he was also cryptorchid. So I neutered him. And first, I kind of decided to ignore the signs of him deteriorating. And then he injured his psoas muscle and couldn't really go to the beach and run and do what he loves to do, because he loves to fish and run the beach, and I like to swim. So suddenly that became really hard for us. And over time, like I basically said, okay, let's rest him and just do everything. And, acupuncture, physio, chiropractics, everything. And 2 years later, I have a dog that still can't go to the beach, that gets injured often, that goes through periods of unexplained, he's got good skin and coat, but unexplained itching, where I go like, I have no idea what's going on. And his little friend, who is about a year younger, the same thing happened to her, different breed, different background, and the same thing happened to her. So,
Yeah.
When I came across your research and also Dr. Linda Brent's research and just kind of started to put the pieces together and remembering all the cases from the past 30 years of me being a veterinarian, I go, oh my goodness, like we are really onto something. And I actually blame myself a little bit because I talked to Dr. Karen Becker, who's my friend, and we talked on that topic a little bit some time ago, but it didn't really dawn on me until this year.
Connect. Yeah.
I guess the questions that I will have, and I know that we will have to make this at least 2 parts or maybe 3 parts. So, because I'm sure that our listeners and viewers will also want to know all the details and know as much as we can pass on and as you can pass on. We have several tasks here. First, how do we deal with the dogs that have not been sterilized yet? Second, how do we help the dogs that have been sterilized and have the issues? And then how do we kind of change the status quo and make sure that this is not happening while we are still preventing overpopulation, right? Because overpopulation and suffering on that level is real. And I don't think that neither you or I want to be perceived as people who say, you should not be neutering dogs and sterilize dogs because, that's dangerous, right? And so there's so many issues.
But men are rendered infertile without removing their gonads through vasectomy.
Exactly.
Right. And that procedure is easily done in dogs, and we can do that at 6 weeks of age.
Exactly.
So at the age that they would go into, leave a shelter. And the same thing with female dogs. We can do a hysterectomy on them, remove their entire uterus. Mm-hmm. They can't get pregnant. They can't develop an infection in their uterus, a pyometra later on. But they still have, their ovaries. There are what I would consider healthier surgical alternatives to permanently sterilizing dogs to prevent overpopulation, but not cause health problems associated with removing the gonads.
So the solution is relatively simple, except there are not many veterinarians who are willing to do this, right? So
I know.
How can we communicate this, and how do you communicate this with vets?
Obviously it's a challenge. With the Parsimus Foundation's funding, we published a study. I want to say it was in 2008, somewhere around then, where we described doing these gonad sparing surgeries, specifically hysterectomy, an ovary sparing hysterectomy. We claimed in the article that this is like the first time that this procedure had been published, and I actually had someone write to me afterwards and said, actually, no, it was first published in 1972, and sure enough. In 1972, in the Small Animal Clinician, it's no longer a journal that we have in circulation, but it was a journal at the time. A veterinarian wrote an article about these health problems that he was seeing after spaying dogs. This is in 1972. And so after seeing these health problems, he had decided as a veterinarian that he wasn't going to remove the ovaries anymore. He was only going to remove the uterus and describe this procedure. So why didn't it take off then? Well, I assume it was because, he was a private practitioner. Maybe that journal wasn't in high circulation. He didn't have any other science to go with it. Now we have lots of evidence from lots of species about the health risks of high levels of LH. We have science that show that there are these LH receptors present all over the dog's body that when they are activated cause these adverse events in the cells where these LH receptors are present. And still, I explain this to lots of audiences, and I have veterinarians walk out and say, well, I'm not convinced.
Wow.
I decided about 10 years ago, since I felt like I wasn't really making a lot of impact talking to veterinarians, that I was going to take my message directly to dog owners.
Mm-hmm.
These
Mm-hmm.
were the people that were really impacted, right? I mean, when your dog becomes sick, the veterinarian doesn't pay for the treatment. The veterinarian isn't there giving it medicine 3 times a day and taking care of it. Can't go to the beach running anymore. You're watching your dog suffer. It's the dog owner. So I thought, well, I'll go directly to the dog owners. And I think that that's made more of an impact because now the dog owners are going to their veterinarian saying, hey, this is what I want.
Yes, yes. And the market demand, right? Virtually. But
Yeah,
so
that's
it's
right.
pretty clear that if anyone decides to control the population and sterilize their dogs, it appears that the more wise or modern or new or more up-to-date method would be hormone-sparing sterilization. Are there any avenues how people can find veterinarians who do this, or can veterinarians learn somewhere? Like, is there a system where
Right.
they can actually refer to or call and say, hey, I want to learn that. Where can I register for this? Because it's surgically, it's not that complicated, especially
That's right.
vasectomy. When it comes to hysterectomy, maybe slightly different technique, but again, it's not much different from the other methods, right?
Yeah, exactly. So to answer your first question, again, the Parsimus Foundation is a not-for-profit organization that is kind of dedicated to coming up with fertility control solutions for animals and humans. And so you can go to their website, but they have a list of veterinarians, who by choice, have said that they want to be on this list. So that's one way to search. There also is a link to a Facebook page that might be kept up to date better. I don't know, of veterinarians who do the procedure. So you can find that through Facebook as well. What I hear commonly, because people will write to me from Connecticut, and I'm on the other side of the country, and say, I can't find a veterinarian, anywhere around here that does the procedure. And, and they asked me, can I just fly to Oregon? And of course they could, but I would much rather teach their veterinarian. I've offered this when I spoke with Dr. Becker, and I'll say this, to your audience as well. If they want to fly me out economy, I am happy to come out and do the surgery with their veterinarian, because that to me, of course I want their dog to have the right procedure, but by teaching a veterinarian how to do it, now that's one more veterinarian that can do the procedure. I'm only one person, and I don't do clinical medicine all the time. I'm mostly doing research. So my ability to do this on a wide scale basis is really limited. But like I said, it's meaningful to me to make the time to go and train veterinarians.
Can I actually interrupt just for a moment? Is there possibility that you could record some sort of instructional video, maybe even
Yes,
post it on YouTube for people to? That would be really amazing, or some sort of way of running an online course that you wouldn't need to teach every single time over and over and over.
So we did make a YouTube video of doing the procedure, and Parsimus Foundation helped me with that. But it was we didn't have a nice videographer.
Mm-hmm.
It was what I would consider a crude recording, right? And eventually Parsimus took the YouTube video down because there were so many complaints about, you couldn't see this, or the lighting was bad, or, And so subsequently, I have an article that's published in the journal Animals. It's a full free text, so any veterinarian can download it. It really goes through the procedure of doing a ovary-sparing hysterectomy, like step by step. And I've got, I think, a dozen pictures that I've taken, that I had someone like my technician, like over my shoulder, in the surgery suite. So we've got good lighting, showing where to place clamps and whatnot. So that I agree. We still need to produce a video. I think that, a video is better than a bunch of still pictures. So,
I have an idea. I think that we should do fundraiser for recording this and share it publicly, because I think that may make a difference. And in this age, we can definitely spread the news a little faster than in the past, 5-10 years ago.
Right.
So that's the hormone-sparing sterilization, and I'm not really sure whether you need to go.
Yeah,
But
and then we can meet again.
let's do it really, really soon, because I think that people would not forgive us if we don't continue the conversation.
Part 2.
And talk about the dogs that actually have been spayed and neutered,
right,
and what to do for them and how to help them, because there are many of them suffering from a number of conditions, from, as you said, skin issues, ear issues, digestive issues, to cancer. And there's such urgency for people to solve these problems. And I'm one of those people who actually have been dealing with dogs that have had the same problems, absolutely clueless, thinking if I do nutrition, exercise, if I reduce drugs, and if I minimize the over vaccination or something like that, they'll be fine.
Right.
And I learned the hard way that it is not true. And it's humbling, but it's also learning, and learning,
right,
as we know, brings us happiness, that we can make a difference. So let's continue. Okay.
That sounds great.
Thank you so much for today.
You're welcome.
And part 2 is coming very, very soon, you guys. So thank you so much, and have a wonderful afternoon. Okay.
Take care.
Bye-bye.